evening to you all. Thanks very much for joining us for this COVID-19 virtual press briefing from the WHO Regional Office for Europe. We'll go straight into it with a statement by the Regional Director shortly, but before that, I'll just introduce the other panel members that will be joining the Regional Director after his statement. We have Dr. Katie Smallwood with us today, the Incident Manager and member of the Emergencies team here at the WHO Regional Office for Europe. We have Mr. Clayton Hamilton, who's the Coordinator for Digital Health, and we're also joined by Dr. Michel Thierin, who's the Special Representative of the Regional Director to Latvia, who is on his way back from leading a team in Armenia, a mission from WHO to support the Armenian government with their COVID-19 response. So thanks very much to the panel members. Thank you very much, the media, for joining us today. I look forward to receiving your questions. We've also received some questions in advance, and I will try to get to those through the course of this press briefing. So with that, I will hand the floor to the Regional Director, Dr. Hans Kluge, to make a statement.
Good morning, everyone. Thank you for joining our press briefing. And let me start with the epidemiological update on COVID-19. Globally, with over 9 million confirmed COVID-19 cases and over 400,000 deaths reported to WHO, the pandemic continues to accelerate, with a record number of new coronavirus cases reported on Sunday, with 183,000 confirmed in 24 hours. Over 2.5 million cases have been reported from Europe. While the European region is reporting a decreasing proportion of global cases than earlier in the year, the region continues to report close to 20,000 new cases and over 700 new deaths daily. Last week, Europe saw an increase in weekly cases for the first time in months. For weeks, I have spoken about the risk of resurgence as countries adjust measures. In several countries across Europe, this risk has now become a reality. 30 countries have seen increases in new cumulative cases over the past 2 weeks. In 11 of these countries, accelerated transmission has led to very significant resurgence that, if left unchecked, will push health systems to the brink once again in Europe. Countries such as Poland, Germany, Spain and Israel have responded quickly to dangerous outbreaks of COVID-19 associated with schools, coal mines and food production settings that have occurred over the past several weeks. Where new clusters of cases appeared, these have been controlled through rapid and targeted interventions. This is very good news. Bravo to the authorities. And on another positive note, several ministers of health have reported a change in people's behavior, namely that they are adhering to physical distancing and wearing facial masks. Bravo to the people. At the same time, we need to get smarter in using the evidence and the information we have from our COVID-19 surveillance systems to improve the only way we have to minimize transmission. Find, isolate, test and care for every case. Trace and quarantine every contact. Here, digital technology can play a leading role, not least to support contact tracing. Austria, Georgia and North Macedonia are among the 27 countries that have released national solutions for digital contact tracing in Europe, with at least another 4 countries, Andorra, Finland, Ireland and Portugal, having solutions underway. Digital technology and artificial intelligence have also proved to be effective in other aspects of the pandemic response. In France, an artificial intelligence-based virtual phone assistant is able to respond to more than 1,000 people at the same time. Italy is trialing use of an artificial intelligence-based technology that utilizes a smartphone app and camera to capture vital statistics such as heart rate, oxygen saturation and respiration rate in real time. In Sweden, Telemedicine has been used to support traditional care, particularly in rural settings, and is now being used for enhanced COVID-19 response. Digital technologies have proved to be powerful tools to fight COVID-19. However, the same technologies have exposed us to a tsunami of information and have raised many issues around data protection and privacy. Here, I wish to convey 3 messages. First, go digital, but go wisely. Digital helps health systems cope with the delivery of essential healthcare, particularly during emergencies. But integrating digital health must be done carefully and wisely, in partnership with the public and patients. Secondly, it's all about trust. Digital tools rely on public trust. Interventions must consider the privacy and security of individuals and their data. Fundamental human and gender rights must be preserved in digital environments and must not be forgotten in times of a pandemic. It is the responsibility of governments to address data ownership, use, consent, and protection. Thirdly, we cannot afford to have people that cannot afford digital health. Not all social groups are equally able to harness the potential of digital technologies to combat the virus. In the European region, national data on household internet access varies from 74% to 87%, with greater variation at subnational levels and between population groups. We cannot afford a digital divide on top of the social and economic divide. So 3 messages. First, go digital, but go wisely. Second, build trust by respecting privacy. And third, address the digital gap. The full potential of digital health is yet to be realized. It is about empowering people to make healthy lifestyle decisions to create a European culture of health. Ultimately, it is about leaving no one behind. Thank you.
Thank you very much, Regional Director, for that statement. And so I will urge you to raise your hands in the system if you'd like to pose a question to our panel here today. And our Regional Director is joined, as I said earlier, by Katie, Clayton, and Michelle. So I have a question first for you, Katie, and it's from Kostas Tavanis at the Hellenic Public Television ERT, and it regards holidays. Holidays in many European countries have begun. Citizens want to travel to countries that are considered safe. However, there are studies that talk about some areas that can function as high transmission areas of the coronavirus. What are the most dangerous places and behaviours that tourists should pay special attention to? Katie, please.
Thank you very much for the question, and of course we're all looking forward to a summer break over the following months. Decisions about how to travel, where to travel, and when to travel need to be taken individually and need to be taken in the context of where we're traveling from and where we intend to go. I would really urge everybody to look at your local authorities' travel advice at the country level. If you're planning on traveling abroad, it's very important that you take into account both the travel advice from your home country, but also where you will be going. Information on how the virus is spreading is available from reliable sources, and again I would urge people to consult those reliable sources of information before you travel, both whether that's WHO's websites where we provide information about cases and how many cases are occurring in specific areas, or the public health authorities of the countries where you're traveling to. In terms of risks, yes, there are still risks associated with COVID-19 in many areas and countries across the European region. So please look at the risks. Also understand who is traveling, what you're going to be doing where you intend to travel, and there the basic principles still apply. Make sure that you're not in crowded areas where there is transmission, that you're able to physically distance. that you put in place all of those protective measures at the individual level that you would do at home, and also take into account who is traveling, if they have any specific vulnerabilities, i.e. if they're older age people, or if they're if you have any comorbidities. When you take into account these factors, it's important that individually, based on the travel advice and on the feasibility of traveling, that you think about doing your own individual risk assessments. Of course, there will be risks in traveling, and it's whether you can take measures to reduce those risks. So please take those decisions wisely and consult reliable sources as you do so.
Thank you very much, Katie. Follow-up question, and this one's for you, Clayton. Can you reflect on some of the key issues facing member states in terms of digital health applications? I think the regional director covered this in his statement, but maybe you'd like to add a few points.
Thanks very much, Rob. Yes, the key points which member states are facing at this point in time essentially is that they're dealing with having to mitigate the impact and the spread of COVID-19 and are trying to employ digital health tools in order to do so. The working hypothesis of using, for example, digital contact tracing tools, which is one of the many tools that are being employed to respond to COVID-19, is that the spread of COVID-19 could be substantially slowed with the aid of a system to automate human contact tracing process, and doing so by identifying and alerting people who have been in close proximity and prolonged exposure to an individual who tests positive. Now, as the regional director aptly pointed out in the beginning, the uptake of such applications are very much rooted in individuals trusting such solutions. And this trust can really not be established overnight. So we're seeing that countries themselves are grappling with having to release these solutions and have them utilized to the greatest extent possible. Of course, what we need to be also conscious of the fact is that the solutions themselves need to be very particular about data privacy issues. So trust can really only be established when data privacy has been incorporated into these solutions from their very point of inception. And then finally, I would say that governments themselves are actually now seeking a range of means to actually kickstart the economic activity once again and to relax public health and social measures. And digital technologies are having a key function in that role as well. So they're dealing very much with issues of trust, they're dealing very much with issues of adoption, and of course, speed is a great issue here in having the solutions ready and tested in order for them to be effective to the greatest potential populations available.
Okay, thanks very much, Clayton. Okay, so we go over to the media that join us online. I'm going to go first over to the Europe office of Shanghai Media Group and Bin Chen. Are you there, Bin Chen?
Hello, can you hear me?
We can hear you. Please go ahead.
Okay, great. So, Europe correspondent of Shanghai Media Group, and as Dr. Kluge mentioned, we see an outbreak in some food production factories in Europe region. So where I'm based in Germany, we see the outbreak in meat factories. So my question focused on why are meat factories the hotbed for the infection? And would the meat processed by the infectious employees still safe for consumers? Thank you.
Okay, thanks very much, Bin Chen. I'm going to send that question over to Katie to respond to, please. Thank you.
Thank you very much. It's an important question, and we're seeing in food production and particularly in meat production a number of outbreaks across several European countries, so in the Netherlands, in Germany and in Ireland, but also in countries outside of the European region. What we're looking at right now is the answers to the very question you've asked. So why is it that meat production facilities and some other food production facilities are more prone to outbreaks of coronavirus? What we see is that there may be very specific contextual explanations to do with the settings themselves that explain that people working within them may not be able to physically distance in the same way, that there are cooler temperatures that allow the virus potentially to remain on surfaces and be spread between people. But we're also looking at broader issues in terms of the types of communities that are involved in working in those facilities, and issues to disentangle really what is driving the spread of the virus in those types of settings. We're working together with the European Centre for Disease Control on those matters, and we'll be looking into the specific outbreaks in more detail over the coming days, and we'll have guidance related to those as we move forward. In terms of the safety of food products coming from facilities, there are stringent rules in place to ensure that, that packaging processes are done with required safety measures, and that in the transportation process we do not see a high level of risk that packaging would be contaminated with the virus. Thank you very much.
Thanks very much, Katie, and thanks for the question, Bin Chen. Okay, so we have a couple of questions that are related here for the regional director from Georgia. The related questions come from Rustavi 2 TV channel and from Fortuna Online Media. And the questions read: how does Georgia cope with the challenge of COVID-19? As you know, in Georgia, COVID-19 is not very spread. What can you say? Is there a reason why this is the case? Have we had very good management, or are there other reasons? When will the second wave hit us? So those are from Georgia for the regional director to respond. Thank you.
Thank you. In fact, I discussed this not so long ago with the health minister Tigaradzde in Tbilisi, and Georgia is one of the countries which early on implemented public health measures. In fact, Georgia started to seriously look at its testing capacity even before the COVID really broke out in the country in January, and as early as the 2nd of March also implemented physical distancing measures. So it comes back to countries taking early on action on the measures we know are working. Very early on, finding, isolating, testing and caring about people with COVID, and then tracing and quarantining the contacts. But Georgia, in fact, I must really comment, goes a step further, namely working on an economic recovery plan with putting health as a top political priority, and also, as was mentioned, working on the second wave. Now, this is one of the most frequently asked questions: when and if there will be a second wave. First and foremost, as one of the colleagues mentioned, we see peaks within the first wave, because the second wave is when the cases really go very, very down and there is a second wave, but we're still in the first wave in many countries. We anticipate that the situation will further calm down in majority of the countries over the summer, but we have indeed to prepare for the fall, when the COVID may meet seasonal influenza, pneumonia, other diseases as well, because ultimately the virus is still actively circulating in our communities, and there is no effective treatment yet, no effective vaccine yet, and hence why it's so important that we are not complacent and engaging the community. And if there are issues with adherence to restrictive public health measures, to try to find out what is it that creates a fatigue to adhering to the public health measures, and then go very targeted to those population groups. Thank you.
Okay, thank you very much. And a follow-up question from Tanta Ugashvili with Fortuna Online Media in Georgia for you, Katie. And it regards public transport. What are the rules? How to travel by bus or by metro? There are so many people on the bus that we can't keep the social distancing. How will WHO's, or what will WHO's recommendations be in this case? Katie.
Thank you very much for the question. And indeed, the rules that should be followed are, of course, those that are requested or required by the government, and in this case, the government of Georgia. As I understand, different countries are taking different measures and putting in place different rules for the use of public transport. Many of these mean that public transport is less congested than it otherwise would normally be. And this is to be able to maintain at least the 1 meter physical distancing that WHO recommends on these types of transport. Where that's not possible, of course, WHO recommends the use of fabric masks or masks by the population in areas where there is community transmission. And as I understand, in Georgia, there is a requirement for people to adopt the use of masks on public transport. So that is in line with WHO's recommendations. But just a reminder that the use of masks is not the be-all and end-all, so that when people are traveling on public transport, they should still maintain distance as much as they can, at least 1 meter from other people, wash your hands regularly, and maintain respiratory etiquette and while you're using public transport. So thank you.
Thanks very much, Katie. Right, and we are in previous weeks we've had a number of questions related to WHO's work in support of the countries and the missions to the countries to support them in responding to the pandemic. So we've invited Michel Thierren to join us today for this press briefing. Michel's joining us in transit in a busy airport on his way back home. But Michel, I'm hoping you can hear us. And I would ask you maybe just to say a little bit about the nature of the mission that you've just been on, and maybe reflect on some of the findings and your with some insight. Michel, can you hear us?
Yes, I can hear you, but it looks like I cannot be on visual. Good afternoon, morning to all, and indeed I'm on my way back from Yerevan, where I spent about a week to look at a situation that is a little bit singular in the region, which is a kind of a curve that is much more swollen, for which the peak is in sight but hasn't been reached yet. And therefore, with a kind of concerns raised by the government legitimately, so we assemble a team of technical people in a number of areas. But the singularity of this mission, perhaps, is that we immediately reached out with all the other sectors and the partners. Why we did that? Because obviously the concern that all countries at some point face is whether a second lockdown needs to be considered. And the assumption we have taken during the mission is to say, look, we have enormous amount of knowledge now accumulated for the past few months on what works on health intervention, but also what works and doesn't on social distancing or societal distancing, on those big measures. And we are now developing a package of measures that is very contextualized for Armenia, taking the position that the country can still have a virus but still have an economy. Of course, not a full-run economy, but we make the assumption that we are in a position, despite the kind of non-friendly looking epi curve there, that we can work out that equation and zoom out completely from the dilemma livelihood versus lives, economy versus health, and so for health, etc. I mean, all this health, non-health dilemma. We are now in June, almost July 2020. As I said, we have a wealth of practices, knowledge from other countries, and we can put a package like this into motion. But that doesn't say that there are preconditions and always some non-negotiable, no-give-in measures, and they were just quoted. The absolute importance and precondition for a customized package is the testing, the tracing, the isolation, the physical distancing. Certainly in a country where enforcement and compliance is a bit complicated, like in Armenia, a more laxist recommendation on the public wearing of masks and measures like this, a vast program of marking the floors, the sidewalks, the public places for QEs, which is not only a measure of protection, but also a communication measure. We have to see in the city that is not business as usual. At the moment in Yerevan, we don't see that much. Not much messages, not much marks, and so forth. So we were very well received by the Minister of Health. We were even received by the Prime Minister to provide that reassuring message and to say, look, we're going to work out something that is not going to damage the population. We are there. Prediction in Armenia, the situation is critical. The curve is ascending. But when I visited hospitals and labs, the health systems operates at its critical limits, but is going to go through with an intense support from the EMT, from the partners, and also because the government is extremely mobilized and concerned, and the response is going to scale up within days. I'm ready for any specific question, and I'll leave it there.
Thanks very much, Michel. So thanks for that reflection, and thanks very much for leading that mission out in Armenia. So we're going to move over now to Interpress News and to Salo Abulashvili.
Hello.
Salo. Hello.
Nice to
Hi.
meet you again.
Welcome back.
I would like to ask today about Georgian occupied territories, and my question will be, like, you know that Georgian central authorities hasn't access in the occupied territories, so we don't know the numbers of transmission and the situation due to COVID pandemic. Maybe in WHO have more information about that. Maybe you have some access on occupied territories, and you know more specifically what is happening in order to the COVID-19 in Georgian occupied territories. Thank you very much.
Thanks very much, Salo. Thanks for the question. Katie, can I ask you to shed some light on that?
Thank you. And WHO works with a range of partners and agencies that are both present in and working in South Ossetia and Abkhazia. And we have been working closely with other UN agencies in understanding the situation, the COVID-19 situation in those areas, as well as working with very closely with the government of Georgia in the rest of Georgia. So we do follow the situation. We are working with partners both at the international level and on the ground. We continue to monitor cases as they occur in those areas, and we provide support consistently as we would to other areas that are considered contested or disputed in the European region. Thank you very much.
Thanks very much, Katie. And we next have a question for the Regional Director from ERT in Greece. Do you think that Greece presents a safe and healthy image for tourists? Regional Director.
Thank you, and Kalimera. Greece is a country like the other ones that we have been working very closely and very, very impressed by the results. In fact, the Greek government, the Prime Minister Mitsotakis himself, took very early on very courageous measures to implement restrictions in line with public health recommendations. And this had its effect, together with a lot of attention to the intensive care capacity in the hospitals, and then again the core of any strategy to decrease the COVID, the finding, isolating, testing capacities. And we're in regular touch with both Minister Vasilis Kikilias, with Vice Minister Vasilis Kontouzamannis. Also, I know that the Prime Minister Mitsotakis appointed a special envoy, Professor Elias Mosialos, on the COVID-19, and this all had its results, and first and foremost, of course, by the Greek population. Now, indeed, there is a gradual easing of the measures, but it's being done, what we recommend, carefully and gradually, like, for example, the one-by-one opening of the airports. And I would like to stress that it's not health against the economy. For a Mediterranean country like Greece, it's very important, the tourism, and to accommodate those, as long as the public health measures are being put in place. And the Greek authorities themselves realize also some challenges in more remote islands where this capacity may be a little bit in the need to be strengthened. But the core is what the Prime Minister was telling, that his ambition is not for Greece to be the #1 destination for tourism, but be the most safe one. And that's something that we really would like to encourage, and we stand ready to further to work together.
Thank you very much, Regional Director. Right, so next we'll go over to Tom Magna. Tom, welcome back in Carers World.
Thank you very much indeed. Can you hear me okay? I just want to check that.
We can. Please go
Excellent.
ahead, Tom.
Your message this morning is very much, it seems to me, that for digital to succeed, there must be public trust. Can I perhaps put an example which I think may be occurring in other countries? In the UK, we have the Welsh government who are very cautiously approaching easing of lockdown. And in England, it seems we have a government who are throwing caution to the wind because of business concerns. How can the public have trust in digital when politicians appear to make claims about technology that can't actually be backed up?
Okay. On that, so Tom, thanks very much for the question. I think there's a couple of people, so Clayton and Katie. There's different elements of that question, so I think we'll go to Clayton first and then over to Katie.
Thanks, Rob, and thank you very much for the question. So the first aspect really is in populations having trust. The biggest factor involved here is essentially one's own personal literacy of using digital tools. And that really is a key factor in the ability for an individual, irrespective of any political circumstances, to be able to make a personal choice of whether or not they feel comfortable or not with using a tool that might be provided by a national entity. Now, in the majority of cases, what we're actually finding, and this is very relevant in the UK, that it's the health authorities with the public health mandate that are actually putting forward the solutions that are delivering or reaching out to deliver a public health utility for populations. So, and what they're actually doing by doing this is trying literally, as is being advised by WHO, every tool in the toolbox in order to assist with preventing the transmission of COVID-19. So really the first aspect is it comes down to an individual's own literacy and trust in the solutions that are being provided. The second component really is to look very carefully at the consent requirements around any particular tool that might be offered. So when tools are offered in order to be taken up by public, there will be consent that is applied. And it's important that individuals do read that consent and understand what the ramifications for their own personal privacy and the privacy of their data are. With those two aspects in mind, then over time, an individual will be very likely to understand and be able to navigate through the digital tools that are available and make conscious choices as to whether they will or will not adopt those tools in protecting themselves and those of their family. And that's really the best approach that we can hope for.
Katie, please.
Thank you. And in addition to what Clayton described, when we're expecting individuals across communities to take actions based on their own self-will and voluntarily, we need to gain trust. And so the trust of the community is one of the linchpins of our overall response to COVID-19, both in terms of digital tools, as Clayton has just described. If we expect people to use them, we may as well be sure that we provide them with a tool that they trust. So absolutely essential. It's a very good question. In broader terms, the same applies. So as societies begin to reopen and measures begin to be lifted, and we still ask of communities to take certain actions, we need to ensure that they trust that what we're asking them to do is the right thing. And there, communities need to really be at front and center and in constant dialogue with authorities, both at the government level, but also at the local authority level. That doesn't mean that things need to happen at the same speed everywhere, and that's where the different contexts, the different moods of communities and the populations and the different perceptions and behaviors will need to be taken into account. So certainly trust is essential, but it doesn't necessarily mean there's a one-size-fits-all response to COVID-19. Thanks very much.
Thanks very much, Katie, and thanks for the question, Tom. We're going to go across next to the UN brief to Maya Plents. Maya, can you hear us?
Yes, thank you very much for taking my question. Our question is related to privacy by design, contract tracing applications that perhaps the WHO Europe has already had the chance to review. Which applications do you think are working and why? And what are the challenges on developing applications that can actually be adopted, that people don't fear for their privacy, that their data is not going to be taken in another way other than by healthcare providers?
Okay, Clayton, over to you. Did you get that question?
I did. Thanks very much. And thanks, Maya, for the question. I think it's an extremely relevant one. Yes, WHO Europe has been particularly vigilant in examining the different digital contact tracing solutions which have been developed by the countries. As the regional director said in his opening statement, we currently have 27 of the 53 member states who have active solutions. Now, with relation to privacy by design, which is one of the key elements in producing solutions which will ultimately develop trust in populations, we really go to a very technical level and to look at how digital contact tracing can actually be implemented. And we've seen a very rich discussion in Europe over the past weeks and months as to what is commonly known as decentralized models and centralized models of contact tracing. And these particular models actually inherently have different levels of privacy by design within them. So what WHO has seen is the transition very much now towards a decentralized model. And this decentralized model means that the matching of the so-called Bluetooth keys, which are exchanged when individuals come in close proximity to each other, are done on the device. This means then that privacy is preserved through the full process of contact tracing, and that populations can feel at ease when they're using these types of solutions. But the particular privacy by design is really only one factor. We need also to be ensured that there is appropriate governance and accountability for digital health right across the chain. And this goes not only to the design of the applications themselves, but also, as I mentioned before, to the privacy of the data. Now, this will have a great impact on, again, developing trust in populations, but really what we are actually looking at is an interesting trade-off between the types of solutions. So on one hand, the decentralized model that
Okay, Clayton, I think we've lost your sound.
Oh, okay.
Sorry, can you just repeat the last like 30 seconds?
I can. Thanks, Rob. So with the privacy by design, really what we're actually looking at is not only the technical design itself, but also the importance of good governance and of accountability for the use of digital contact tracing. That means essentially that member states have an independent third party that monitors the use, consent, storage and transmission of data and certifies that in fact it is used according to the principles that the national health authorities put forth. I'll leave it there. Thank you.
Thank you very much, Clayton. Right, and changing tack somewhat, we're going to go to TV2 in Georgia. And for you, Katie, a question: how successfully is dexamethasone used to fight coronavirus?
Thanks for the question. So over the past week, we've had some really positive results communicated to WHO and to the broader world about the use of dexamethasone in patients that are hospitalized and requiring oxygen therapy. WHO has received the results from the recovery trial that has been taking place in the UK and is looking at other results from other trials that have looked also at dexamethasone to bring together these results and have a full analysis of the positive results that were communicated to us. Indeed, dexamethasone is an affordable and widely available drug. It's a corticosteroid that has been found to have shown a positive impact on mortality in patients that are hospitalized. That is a reduction of 1/5 of deaths in patients requiring oxygen, and 1/3 of patients, fewer than 1/3, a decrease of 1/3 in mortality in patients that are on ventilation. So for hospitalized patients, we see this as a very, very good news. But there's still a little bit more to understand. We're looking at our clinical guidance as we speak, and those will be updated in due course. Important to note here, though, that just as dexamethasone, the results show very important results for severe cases, this is not necessarily the case for mild cases. So patients should not be taking dexamethasone for unless under very close medical supervision, and should not be looking at taking dexamethasone as a prophylactic use. It should only be used, if at all, in hospitalized patients. Thank you.
Okay, thanks very much, Katie. I don't see any further questions from the floor, so I'm going to thank the Regional Director. Thanks very much to the panel and to the media for joining us today. And until next time, please stay well, stay safe. Thanks.